Good morning. This week we will officially enter a new chapter in our country with new leadership in Washington, with the new administration prioritizing vaccine distribution and making decisions based on the grim realities of this pandemic. Local governments feel like they truly have a partner in curbing this virus. The vaccine rollout that began last month is up, and the desire to get a shot in the arm is understandably strong. More than 172,000 people have pre-registered through St. Louis County's Department of Public Health to be notified when it's their turn, based on eligibility. Every day, thousands of people across the country continue to test positive for COVID-19, and getting a vaccine is a race against time. We urge people to be honest when pre-registering and think about those you could be bumping from line. The state outlined its tier system last week, and we are adhering to that system. But for the system to work correctly and to get the shots to those who need them the most, we need everyone to be honest about their demographics and their employment information. Our Department of Public Health is using this information to determine what phase or tier each person who pre-registers belongs in. We have seen some instances where those who say they are healthcare workers are not. Others have brought spouses or other family members along who are not eligible for the vaccine. We have had high school students show up for appointments who misrepresented who they were on the form. This has not been a huge problem, but as the availability in vaccines increases, those showing up who should not be in line will ultimately slow down the process, elevate tensions, and deprive a vaccine to our most vulnerable and those who are most likely to have severe outcomes if infected by the virus. Our health department workers should not be distracted by this and should not be put in a position to turn someone away because they were not following the rules. On this federal holiday honoring Dr. King, the words of the great civil rights leader ring as loudly throughout our communities today as they did more than 50 years ago. Dr. King's work highlighted the division in our country, poverty and privilege, the demographic differences that define us and determine where we are in line for access to quality education, housing, and health care. As vaccine distribution moves from healthcare workers and nursing homes to a greater population, we are committed to getting this life-saving shot to those who have historically been underserved and disproportionately impacted by this pandemic. And we need everyone in this honor system to be honorable. We will get to everyone, but we urge patience. Last week, the health department administered 883 shots and expects to get through the remainder of the 975 doses it received from the state by the end of today. We expect more vaccine to be arriving tomorrow, and we are not yet setting up appointments for Tuesday because we do not know how large our supply will be. We've asked for double what we got in the first round. Once the new supply arrives Tuesday, we will notify the public and immediately begin setting appointments from our pre-registration list. For months, the health department has been working with hospital systems in the state to prepare for mass vaccine distribution when the supply chain increases. Our planning started with a world of potential. If we had unlimited supply of vaccine and unlimited resources to administer it, what would that look like? Those plans are designed to easily fit the reality of the moment based on limited vaccine doses and using existing county funding. When we receive federal funds through the state and more vaccine doses, we are positioned to expand our efforts. We are aggressively working with community partners to open a variety of vaccine distribution sites across St. Louis County to make it as easily as possible for many people as possible to have access. We are in the process of selecting our first mass vaccination site, which will be in North County, where the virus hit early and hard. We are looking at several sites, keeping in mind it must be a location to easily social distance inside while people are getting the shot and during the 30-minute observation period afterwards. With the Pfizer vaccine, we must make sure we have a spot where all the vials can be kept at a very specific temperature. And the site must be one that is secure. We do not want the site to be one where people are waiting outside during St. Louis winter. With the weather and the strong recommendation from the CDC and vaccine manufacturer that those who receive a shot be observed for an adverse reaction, we are in the position of waiting a bit longer to create drive-up sites. Meanwhile, the health department is expanding its clinical hours with the expectation of an increased supply of vaccine. We're working to make sure that those who use our clinics for other health issues will continue to receive services, and the logistics of that are underway as well. It's critically important that disruption to our service for clients is at a minimum. We are doing all that we can to be ready when the vaccine supply expands so that we can get as many people protected from this virus as soon as possible. I'd be glad to answer any questions.
Dr. Page, I thought you might want to remind folks about, we have a new FAQ going up on the website today.
All right, so there's a lot of questions in our community, understandably, about all the details of the vaccine distribution and the vaccine planning, of how to get a vaccine, how to get in line. Those frequently asked questions, those FAQs, are posted on our website. Were posted this morning. For anyone who wants more details, they can go to stlcorona.com and look at those FAQs.